Hi, welcome everyone to our Cecilia Health webinar. I'm Emily. I'm one of the dietitians and diabetes educators here with Cecilia Health. Tonight, one of our dietitians, Nancy, will be talking about chronic kidney disease and cardiovascular disease. Here at the bottom, there is a phone number. Just to keep in mind is 1-800-263-6317 in case you have any issues. All right, so as always, we really like an interactive program. And what that means is that Nancy will be doing a short presentation, really talking about how CKD and CVD, how they affect one another. And then at the very end, there will be some time for questions. And you'll see that here with your toolbar off to the right. Please feel free to enter in any questions or comments that you may have, and she'll be able to answer those at the end of our webinar. Now, as always, we know that the information you are about to hear may motivate you to make some changes, but please do talk to your doctor before making any changes to your current routine. The Cecilia Health registered dietitian will provide strategies to help you manage your CKD, and this online Q&A session is intended to give general advice. It's not meant to be a substitute for personal medical advice, and it also involves the professional opinion of the Cecilia Health RD as well. So here tonight, I'd like to introduce Nancy Cohen. She is one of our registered dietitians. She currently lives in Pennsylvania. She has her degree in nutrition and dietetics from the University of Florida and has been working in the nutrition field for over 40 years. She educates clients in all areas of medical nutrition and wellness and is happy to be a member of the Cecilia Health team. She is a mom of an adult 31-year-old son, has a passion for her beautiful Weimaraner dog Dinah, and she loves to work with all of her clients online in the Cecilia Health CKD and weight management programs. She brings a positive attitude to all on ways to incorporate good nutrition into life and make the most out of every day. So thank you all again for joining us. I'm going to pass it off to Nancy. Thank you.
Oh, well, thank you so much, Emily. You know, it is absolutely true. I love being a dietitian and I love all my Cecilia Health clients. So we're delighted that you could come on and listen to the webinar, whether you're listening to it live or in a recording. So tonight's topic is really interesting because it's not just about CKD, which stands for chronic kidney disease, but it's also about heart disease. And we're going to discover what the relationship is between the two of them. So just settle in and just take in the information. And thank you for being here. So on our agenda, we are going to go through these topics. What is heart disease? CKD and heart disease, symptoms of heart disease, causes of heart disease, the tests that your doctor may order, and treatment and prevention. And of course, remember, all of this is guided by your physician, but we are sharing general health and wellness information for you to start thinking about. Also, we'll touch on medications, surgeries, and my favorite as a dietitian, healthy eating for heart disease and CKD. So let's get started. Okay, so what is heart disease? Heart disease describes a range of conditions that affects the heart. Heart disease includes blood vessel disease, such as coronary artery disease, irregular heartbeats, which is called arrhythmias, heart problems that you might be born with, that's congenital heart defects, diseases of the heart muscle, and heart valve disease. Many of the forms of heart disease can be prevented or treated, however, with a healthy lifestyle choice. When the kidneys don't work well, it does put more stress on the heart. When someone has CKD, their heart needs to pump harder to get blood to the kidneys. So this can lead to heart disease, the leading cause of death in the United States. Also, changes in blood pressure, which is a CKD complication, can also lead to heart disease. So these are some of the symptoms of heart disease, and I'll just name them all. And again, pay attention to them and, of course, bring them to your physician. So sudden dizziness, heartburn-like feeling, cold sweats, unusual tiredness, nausea or vomiting, and they're saying those are in women. In the masculine side, most common includes shortness of breath, chest pain, and discomfort or tingling in the arms, back, neck, shoulder, or jaw. Some of the causes of heart disease include, this one is called cardiomyopathy, and it's the thickening or enlarged heart muscle. So dilated cardiomyopathy is the cause of this is most common is unknown, and it could be passed down through families or inherited. And the dilated cardiomyopathy typically starts in the heart's main pumping chamber, the left ventricle, and many things can lead to this, including heart attacks, infections, toxins, some drugs, and some cancer medications. Another form of heart disease is called hypertrophic cardiomyopathy, and this is typically also passed down through families inherited. And the third one is called restrictive cardiomyopathy. This is least common type, and it can occur for no known reason. Sometimes it's caused by a buildup of proteins called amyloid in the heart, and it's a connective tissue disorder. So coronary artery disease is a buildup of fatty plaques in the arteries, or atherosclerosis, and it is the most common cause of coronary artery disease. Risk factors include a poor diet, lack of exercise, obesity, and smoking. Healthy lifestyle choices can help lower the risk of atherosclerosis. Another form of heart disease that can cause heart disease is irregular heartbeats, cardiomyopathies, which we just spoke about. Diabetes can cause heart disease, drug misuse, emotional stress, excessive use of alcohol or caffeine, heart problems present at birth, high blood pressure, smoking, heart valve disease, and then use of certain medications, including those bought without a prescription, and herbs and supplements. A heart infection can cause heart disease, such as bacteria, virus, or parasites that get into the heart. Heart valve disease can be caused by rheumatic fever, infections, and connective tissue disorders. And so that was a lot. There's a lot of different ways you can have heart disease. And again, you'll work directly with your doctor to see if you are well or if you can prevent it. Now let's look at some of the tests that they offer to see if you have heart disease. You may have heard of a bunch of these. The first one's called an electrocardiogram, an ECG or EKG. This test is neat. An ECG is a quick and painless test that records the electrical signals in the heart, and it can tell if your heart is beating too fast or too slow. The next one is a Holter monitor, and that's what that man has over his head, that blue box. A Holter monitor is a portable ECG device that's worn for a day or more to record your heart's activities during daily activities. This test can detect irregular heartbeats that aren't found during a usual exam. The third type of test is called an echocardiogram, and this is a non-invasive exam, and it uses sound waves to create detailed images of the heart in motion. It shows how blood moves through the heart and heart valves, and an echocardiogram, that's a sound, it's the sound waves. An echocardiogram can help determine if a valve is narrowed or leaking. Another type of test, maybe some of you had had this, is called an exercise or stress test. These tests often involve walking on the treadmill or riding a stationary bike while your heart is being monitored. These exercise tests can help reveal how the heart responds to physical activity. and whether heart disease symptoms occur during exercise. If you can't exercise, you might be given medications. A few more tests for heart disease include these: the cardiac catheterization. This test can show blockages in the heart arteries. A long, thin, flexible tube is inserted into the blood vessel. I'm not going to go into all those details. The cardiac catheterization is a test that your doctor does in the hospital or in his office, and it actually shows how your arteries look in the test. It's very interesting. There is something called a heart CT scan where they also do an image of your heart. And then, of course, you've heard of an MRI, and there is one done for the heart. So lots of interesting tests that reveal a lot of information. If you should need to have one, I'm sure your doctor knows why they ordered it. So many medications that we get to use, and of course, they're appropriate for you if your doctor says so. So there's anticoagulants, there's antiplatelet medications, there's what they call ACE inhibitors, which is it allows your blood to flow more easily. And then there's the angiotensin receptor blockers, and these help keep blood pressure from rising. There are more. The angiotensin receptor, I'll just say they are the ARNIs. They improve the opening and blood flow of your blood. There are beta blockers. There are combined alpha and beta blockers, and there's also calcium channel blockers. So again, trusting your physician and your cardiologist, for they know why they're ordering things for you. Cholesterol lowering medication is very valuable. There's also medications in the digitalis group that helps with heart contractions. There are diuretics that maybe some of you are on for the kidney disease, which help reduce excess fluid and reduce the workload on your heart. And then there's also vasodilators, which relax blood vessels and decrease blood pressure. Wow, that's a lot of information. I hope you're all doing well with that as we move forward. Okay, there are a whole bunch of surgical treatments for heart disease. I'm going to name them for you here tonight, and you may have experienced them, but you know that you're always in good hands with your doctor. There's angioplasty, there's heart valve surgery, there's atherectomy, there's bypass surgery, there's cardiomyoplasty, there's heart transplants, and then there's minimally invasive heart surgery. There's radiofrequency ablations, and there's stent placements. And then there's this transmyocardial revascularization, the TMR, which seems like, and I can't tell you which is best for you, of course. Hopefully the least is best, and there's a lot of information. So check in with your doctor if you need any of these. They will guide you correctly. Okay. These are the things that you can work on. And I'm delighted to say that with proper nutrition and exercise and rest, with your doctor's permission, there's lots of great changes that you can make. So let's see what they include and how many of these work in your best interest. So lifestyle changes for treatment and prevention of heart disease include being active for 30 minutes or more most days. So be sure to discuss any new activity goals, limitations, or recommendations with your doctor. Learning stress management techniques for healthy coping, because research has shown that by having a lower amount of stress, you have a lower heart rate. It helps lower your blood pressure, and you can always ask about this from your MD or look up some tools from the American Heart Association or the Kidney Disease website and learn for some of those lovely stress management techniques. They say that it is really of great value to get a good night's sleep. So aim for adequate sleep and see if you can get close to 7 to 8 hours a night. And don't smoke. Smoking is a major risk factor for heart disease, especially atherosclerosis. Quitting is the best way to reduce your risk of heart disease and its complications. If you need help quitting, talk to your provider. And be sure that if you've been given medication that is in your health's best interest, take your medication as prescribed. So, those are some really lovely lifestyle changes that are all doable. Let's see what else we can do. So, it's important to manage other conditions for the treatment and prevention of heart disease. Maybe you didn't know these. Work on controlling your blood pressure. So, uncontrolled high blood pressure increases your risk of serious health problems. Get your blood pressure checked at least every 2 years if you're 18 and older. And if you do have risk factors for heart disease or are over age 40, you may need more frequent checks. Ask your healthcare provider what blood pressure reading is best for you. Another really great tool is to get a cholesterol test. Ask your provider for a baseline cholesterol test when you start in your 20s and then at least every 4 to 6 years. You may need to start testing earlier, especially if high cholesterol does run in your family. You may need more frequent checks, and if your test results aren't in a desirable range, you may have risk factors for heart disease. So keep your eye on the cholesterol. And then, of course, manage diabetes. If you do have diabetes, tight blood sugar control can really help reduce the risk of heart disease. Well, here we go. One of my favorite topics, nutrition. So, what nutrition can we follow for treatment and prevention of heart disease? This is really a great tool for you for good health, to prevent heart disease, and just be well. So, when we look at nutrition for a healthy heart, it's really important to control your portion sizes of food. Overloading your plate can lead to consuming more calories than you should. We really wish that you'd eat more vegetables and fruits. Choose non starchy vegetables over the starchy. Select high fiber grains and starches. Look for the foods that say 100% whole grains or if whole wheat is the first ingredient. And what they say is that the fiber, actually, different types of fiber, besides it helps your digestion, your weight, your portion control, there are certain types of fibers that can actually assist you to work on lowering cholesterol. So, really good news with all of this. Limit your unhealthy fat intake. So, eating a diet low in saturated fat by limiting animal fats from meats and high fat dairy products can really make a difference. Avoid what they call trans fats by limiting, you find these in fried foods, fast foods, and processed baked goods. And choose healthy fat sources like olives, olive oil, nuts, seeds, avocados, and fatty fish like salmon and sardines. Look to choose low fat protein sources. And these include whole eggs, quinoa, egg whites, and fish, and also some lean sources of poultry. There are many low fat protein sources, and you can speak to your dietitian or healthcare provider about them. And be sure to work on lowering your concentrated sugar intake. So minimize concentrated sugars from sweets, sodas, and juices. Another aspect of nutrition for a healthy heart and your kidney as well is to work on limiting or reducing your salt intake. Limiting your intake to 1 teaspoon of salt a day is a great place to begin because a teaspoon of salt has 2,300 milligrams of sodium. So if you're a big salt shaker, try to use less or try herbs and spices instead. Be sure to avoid salt substitutes that say new salt or no salt. And we bring this up because in some of you with chronic kidney disease may have a potassium restriction. So make sure you speak to your physician about may you use a new salt or no salt product or not. But that's the primary reason for bringing it up now. When you're shopping, choose products that are canned or jarred that say no salt added on the package. A lot of products from our past have a lot of salt in them or sodium, and you can read that on the label. So no salt added is a great way to reduce your salt intake. Prepare and cook your meals from scratch using one of our kidney-friendly recipes, and you can find those in your kidney nutrition information or on our website. So preparing and cooking your meals from either a kidney-friendly recipe or just from scratch where you know what you're putting into it, you can control the amount of salt in your food. You can also use fresh or dried herbs and spices to add extra flavor for your dishes instead of salt. Sounds delicious here. Another option that you can do is drink water instead of sports drinks or sodas. I don't know if you ever knew that a lot of the sport drinks are high in sodium. So really consider, can you switch over to water in its place? And when you are eating out, ask your server if your food can be prepared without any added salt. These are all great tips that you can do yourself without any guidance from your physician. Okay. So it's really wonderful to work with all these wonderful eating tips. One of the great things you can do is plan ahead. Create daily menus following the previously mentioned guidelines, which was what? Using lean sources of protein, watching your salt intake, upping your fruits and vegetables. Those are things that you can all bring into your lifestyle. So do a little menu planning. I think that's a great idea. And of course, allow an occasional treat. A small treat enjoyed occasionally will not derail your meal plans. So we're at the end of the presentation for now. Does anybody have any questions that they would like to ask about the relationship between heart disease and chronic kidney disease? And I don't see anybody asking one, but you can see that there's a direct relationship between taking care of your weight and your diabetes and your blood pressure and eating healthy. And across the board, you'll have good kidney health and also support having good heart health. We're always so delighted that you can join us at Cecilia Health, and we're here to answer your questions. And I believe that they can just write us on our website or call our phone number. Is that right?
Yeah,
I'm in.
thank you. Yeah, thank you, Nancy. Yeah, that's a great point. If you have more questions about, with your kidneys or with your heart, those are really great questions to, bring to the table next time you talk to your Cecilia health coach as well. I know we have a lot of different programs, but I'm sure they would be happy to kind of talk to you more about what questions to bring up to your doctor even, or to be talking more about nutrition and exercise as well. You see here coming up in March, we'll be focusing again on healthy eating with CKD, and then in April is really focusing on with long-term maintenance and also emotional barriers as well. But thank you all again for joining us tonight. Thank you, Nancy, for your time. If you have additional questions, you can always check out the Cecilia Health website as well. So thank you so much. Have a great rest of your evening. Bye-bye.